Get more on our main story. The government plans to draft in managers from top-performing NHS hospitals in England to help improve failing ones with bonus payments for success. Well, Matt T is from the NHS Confederation, the body for organisations that commission and provide NHS services. He's in our Central London studio. Good morning to you.
Good morning.
Is this a good idea?
Yes, we think it is a good idea. I think what this is doing is putting in place a sort of more official version of something that happens quite a lot already. I think what we see around the country is already successful hospitals helping out with other hospitals which are perhaps a bit less successful or struggling somewhat. I think what's interesting about this is that we're talking about a financial payment being involved in it, which means I think the Secretary of State is hoping that this means we'll use management consultants less than the health service and so on. But certainly the idea of hospitals learning from each other and helping each other to improve is something we support very much.
He said this new training structure was key to turning doctors into fantastic leaders. Do doctors make good managers?
Well, I think what we're seeing increasingly across the NHS is doctors becoming chief executives of hospitals. And I can think of several good examples. Sir Jonathan Michaels, who I work with, is now the chief executive at Oxford University Hospitals, for example, and very, very much respected. So I think the experience that doctors bring of face-to-face care with patients can be a very valuable experience to bring to being a chief executive of a hospital. So we'd certainly welcome the scheme to develop doctors into managers. We think there's also space for people who've been managers for all of their career.
There could be some resentment in those poorer performing trusts if others come in from better trusts and tell them what to do.
I think it's very unlikely that it'll be done in that way. I mean, certainly some of the examples that I've seen already would be much more that this is about providing help and support. It's where, for example, one hospital has a department that's very good at something, going in and seeing if some of the lessons they've learned can be applied in another setting in a different hospital.
Where did this problem start? Is this a political, a dogma issue, or is it just, frankly, there's still a fundamental problem of too few people, too few nurses, too few doctors?
Well, I think what we find is that there are some hospitals, particularly some of the smaller district general hospitals, who are struggling because they don't deal with the same throughput as some of the big hospitals. They don't have the sort of spare capacity to be able to develop things like good information systems that help them to understand what's happening in their hospitals, and where, for example, they may have a problem with mortality.
And you don't have an issue with the better performing trust being reimbursed if there's success?
It seems to me it would be a folly to say to a well-performing hospital, you're going to help out the hospital down the road, but in doing that, you're going to be effectively penalised because we're going to take your good people and put them somewhere else. I think it's absolutely right that those hospitals should be compensated in some way for lending their staff and their expertise to other hospitals.
Matt T, thank you very much for your time this morning.